So coming towards this section with complications, there are a list of varieties of complications that a patient with diabetes mellitus could present, and it's very necessary to avoid these complications as much as we can and advise the patients with diabetes mellitus to protect themselves from these complications. So what are these complications? These includes number one being ketoacidosis. Like I've mentioned before, that the patient might present in the emergency department with a list of clinical features that we've mentioned before, and this is one of the acute and very dangerous complications of diabetes mellitus. If not treated on time, the patient might die within an hour or within a few days. So infections, as the patient is very prone to developing different types of infection and he's very immunocompromised, so it's very necessary to avoid these infections. Nephropathy, as I've mentioned, that we're doing a lot of different kidney functions test, and this is to assess if the diabetes has affected the kidneys or not. So it's very necessary to rule out any disease towards the kidneys. Retinopathy, it's very necessary to have a very regular fundoscopic examination and eye examination to assess if there's any diabetes affecting the eyes. Neuropathy, like I've mentioned before, assessing the legs and the arms, having a complete neurological examination. If the patient comes up with complications and symptoms such as tingling and numbness, so it's very necessary to assess the patient having any sort of neuropathy. Cardiovascular diseases, it's usually very common with patients with diabetes mellitus, and these patients are predisposed to different heart diseases and atherosclerosis. So this is also avoided by having regular tests such as ECG and having lipid profile done. Hyperlipidemia, like I've mentioned, that having lipid profile done, we need to assess if the patient has any sort of increased lipid or increased cholesterol. And lastly, diabetic feet is very necessary. It's a very, very difficult complication and it can be avoided, but it's very necessary to ask these patients to take care of their feet in a sense that they're supposed to keep checking if they have any injury towards the feet. Because of the loss of neurons in their feet, it's very common that they develop injury towards the feet, and the injury, it goes unnoticed, and the patient might have a complete disaster that is termed as gangrene. So the patient might have gangrenous foot in the end. So it's a complication that is very, very dangerous, and ultimately the patient might have to amputate his feet or his leg. So this is a complication that can be avoided on a regular basis by checking his diabetes and controlling his diabetes. So these are the list of complications that can be avoided in diabetes mellitus if regular testing and regular control of the sugar is done.